And welcome back. Our next guest is a life and health insurance advisor and the founder of On10 Solutions. Get ready. She joins us to highlight important information about open enrollment periods for health insurance plans and to speak about the ins and outs of Medicare and Medicaid and all the other things that's attached to it. So please welcome to the show, Nakeeta Wills.
Thank you.
How are you?
I'm wonderful. Thank you for having me, Dr.
Yes,
Lee.
nice to see you. I saw you out in the community. I see a lot of my guests out in the community, and they say, "Hey, we saw you on BronxNet. We hear you on BLS. Can we come and be a part of your show?" So welcome, welcome, welcome. And tell us a little bit about the Medicare and open enrollment and about yourself first.
Absolutely. So I am a health insurance advisor, but I like to look at myself as a navigator and also as an advocate.
Yes.
Because I'm helping New Yorkers navigate both Medicare, Medicaid, and also I'll support some caregivers about their choices about benefits each year. Open enrollment is a special time because everyone has an opportunity to take a look at their plans and see what's happening for next year.
Yes.
It's during the time right now that a lot of carriers make changes to their formularies or drug list, their doctors, and sometimes their plans and as a whole. So now is a great time to take a look at that.
Yeah, because a lot of people may say, you know what, I'm not too happy with this one, or I can't, you said you're a navigator, I can't navigate this myself, I need help. And so you're a person who can make it a lot easier for me.
Sure, sure. One of my skills is breaking things down in a concise, clear manner with people. Recently, I got a card from someone with a thank you gift, and she goes, "Best in the business." And that meant a lot to me because it made me feel like she felt seen, you know. Medicare can be overwhelming. It's not just the seniors that get overwhelmed. Some of the young people, they're dealing with a lot of specialists that they don't understand the complex system, plus what they're trying to do just to keep themselves well. I pride myself on breaking that information down to them in small bites and also staying with them throughout the process.
I know a few of them too. They get frustrated because they can't understand it and can't break it down, and you're not feeling well too.
Sure.
So it's like a mind and body thing that's not working right because you don't understand what's going on.
Absolutely.
And so what are some of the things you do to help people understand or help navigate them through this situation?
So one of the first things I do is look at their situation as a whole. Who are your doctors? What is your lifestyle? What prescriptions are you taking? Which pharmacies do you go to? And creating a clear picture, and then being able to take those and make their make what I'm doing for them, their recommendations based on who they are, their lifestyle, and the things that they already need. I'm not in the business of trying to change your doctors or change this. If you're already doing something, I want to find something in perfect alignment with that. And that's where I shine at, because I take the time and actually do that with them. And it can be a daunting process, but once you get to know them, you can kind of predict over the years. And it just keeps going. If I had them at Medicaid, I can see them into Medicare. As they get older, their needs change. Now they need home health care. There are other community resources that I'm able to pull in and pull together and have them work for them.
Wow, Nakeeta, how did you get into this? Because did you experience somebody in your life, mother, father, grandmother, father,
I wish,
who was going through something like that, and you said, you know what, they need an advocate. They need somebody that can stand in the gap and help them through this?
Well, actually, I have family members that I had to deal with. Actually, my life partner, he had to go through the disability system and then being put on Medicare. My grandmother, I was always there with her home health aid changes and things like that. But my advocacy comes from always wanting to help. I spent 15 years in corporate America working in media and construction, and then I came to this by fluke. And I'll tell you, it's the best job I never had because it's doing my life's work. I'm actually helping people.
You love it. You found your purpose-driven life.
Yes, I'm actually helping people and making a difference.
It's always important when you're helping others get what they need out of life. Our producer, he knows I say that all the time. On10 Solutions. tell us about that and how you got it started. It's up on the screen right now.
Oh, wonderful. On10 Solutions is my company, my brokerage firm that I do my business under. We are a sole proprietorship based here in New York, and that's what we do. We connect with people by providing education and then moving on to enrolling them into various plans and services that are available in the market for Medicare, Medicaid, or state-based prescription help throughout the state.
Are you concerned about healthcare being cut in many different areas?
That's so funny that you mentioned that. And you may be referring to the state budget, or sometimes the big beautiful bill, as they call it. I am not concerned about it going away. New York is a very democratic state. I am concerned about people who receives it and how they receive it, because that is what's changing. We're not necessarily not giving people things anymore. The state is now just being a little more pointed at how they distribute the help. And that's important. I think we always have to have some sort of accountability as we do things.
So what are some of the common mistakes that seniors make during open enrollment?
I believe one of the biggest mistakes that seniors make is thinking that they don't need to do anything. When I present, I typically tell people that it's like a doctor's visit, a wellness check. You need to do it every year.
Or afraid to make changes.
Yes,
And
definitely.
maybe stuck in something and they're just going through it.
Definitely. Or they work so hard to get where they are, they think it's not going to change. But even sometimes incremental changes can make a big impact on what happens in the following year. You don't find out until you go to the pharmacy, and then you have this extreme amount of copay to pay on a medicine that you could have quickly avoided if you would have known it wasn't on the formulary anymore if you took a look in the fall. So it's dire to actually take a look, even if you don't make changes. But we become ambivalent a lot of times when it comes to brokers and agents because you're not sure if they have your best interest in mind.
Yeah, I experienced someone who was raising sand about a plan that they had, and that they received the copay, and they just went crazy. They said, "What? How the?" I didn't say that. I thought I was covered, and all that stuff.
Sure.
You are covered to a point, but you're still responsible for certain things. What should people watch for in choosing a plan based on a doctor's medications and their budget?
So I think when you're looking at a plan, you can actually look at a carrier's response. For instance, some carriers have they're based in religion, so the way they make coverage decisions makes a difference. Some of them don't take just straight, you have to do referrals, so you want to make sure that you don't need those type of things. The networks that they serve is very important. Just when people are coming into a meeting with me, I always tell them, bring your list of prescriptions, bring your doctors, bring the pharmacy. I actually have a checklist that I can check off with them or have them do on their own. And then also have a little wish list. I need some transportation. I want OTC. I want vision is very important to me. I have to have dental. Put those on your wish list. We might not be able to get all of them, but the goal is to connect this as close to your lifestyle as we can.
And some places give you a discount if you're taking care of your health, like on a workout program, healthy eating, healthy living type of thing?
Yes, they're on rewards.
Rewards.
Yes, they're definitely rewards just for getting your wellness checks. And I hate to say this, but it's the truth. Insurance is not in the business of paying, right? So the more well you stay, the less they have to pay. So they'll give you incentives for that. Giving you a $10 gift card is much better than paying for a surgery.
That's right.
So
they stay healthy. I won't have to spend this money.
Exactly.
that you give me.
They give incentives all the time.
And some of the resources available to seniors and caregivers are so very important.
Yes, they are. Some of the resources that are there, actually this year, very important for caregivers. They're actually having some type of training because we have now family members taking care of the family. I want to say seniors because sometimes they're younger. So now they
get
have
paid for that, too.
Yeah, you can get paid for that. So now they have resources to actually train these people. What happens? The signs of stroke. So that is one of the incentives that they have this year.
Yeah.
There are prescription drug programs also funded by the state that can assist people, like Epic, for people under $100,000. Have you heard of that one? That is very helpful. It's also known as a
So
SHIP
you know
program.
the ins and outs. There
Yes,
you go.
there's programs for diabetes. There are programs for. There's also programs for. Another one for 65 plus is leaving my memory right now, but
But
there's a
that's
whole
right.
list
All
of
the
them.
stuff is on your website?
Yes, and it's individually based. So I don't just give them away. If I speak in person, I bring materials with me
Yeah.
and I'll tell people about them. But overall, it's usually in a consultation. I'll just say, oh, why haven't you done this? Why haven't you done
Yeah.
that? And I'll pass those information on.
Yeah, give us tips and all that stuff on your website. What's the website
Yes.
right now?
My website is www.on10solutionsny.com. That's the number 10.
There you go.
Yes.
Nakeeta Wills, Healthcare Navigator and Senior Advocate, founder on 10 Solutions. Thank you so much. Thanks for joining us.
you. Thank
you got it all
you.
out there?
Yes. Yes.
That's what's
I
up.
think
Put all
so.
that other stuff on the website. Website one more time is?
www.on10solutionsny.com.
There you go. We'll take a quick break. I've got more. It's all happening next on Open.